Hello, this is Dr. Michael Shear with Learn LODI, a free resource on how to market, treatment plan, place, and maintain LOCATOR Overdenture implants. The purpose of this YouTube video is to describe a clinical technique to duplicate a patient's existing complete denture into a surgical guide using a simple laboratory protocol. What we're going to do is we're going to go ahead and take our patient's existing complete denture, which is similar to what I have in front of you. This is a denture that is meant to fit on top of this replica or this study model that we use for implant placement exercises. What we're going to do is duplicate this into this clear duplicate of that patient's complete denture, and then also show you how we prepare pilot holes to assist in implant surgical placement of the LOCATOR Overdenture implants. I'm going to put these aside for now. We have our patient's existing complete denture, and this is simply just a simulation of a clinical situation of a patient who presents to your office who would need the stabilization of 4 LODI implants in the anterior mandible or potentially in the maxilla. This is just showing you an example of a replica sawbones style styrofoam mandible. Imagine this is our patient sitting in our clinical chair. They say, I'm interested in having my denture stabilized. Yes, of course we can do that for you. What we'd like to consider is 4 LODI implants in the anterior mandible. What we're going to do is evaluate the patient's complete denture, and we're going to duplicate this into our clear duplicate. The first step is we go ahead and we remove the denture from the mouth and inspect it everywhere. And we're going to verify that the denture is a properly fitting as well as a clinically acceptable denture. First and foremost is we want to make sure that it fits on the alveolar ridge. The patient is satisfied with the aesthetics as well as the function of the complete denture. Once all of those things have been verified, we now know that yes, this is an adequate complete denture, and we're ready to move forward with the LODI preparation. So at this point, what we're going to do is we're going to take putty. And this is just showing you some sort of generic type putty, a very inexpensive clinical putty, or you can utilize laboratory putty that's available, commercially available through any sort of a supplier. This is just showing you more of a clinical putty just for simplicity purposes. First step is we take our putty and we measure out 6 scoops. So a total of 3 base and 3 catalyst. As you see in front of you, we have 3 scoops of the base and 3 scoops of the catalyst. I'm going to take my patient's denture, and I'm going to just kind of liberally coat the denture with petroleum-based lubricant, such as Vaseline. At this point, we're going to take our putty and start incorporating it together, just by kneading. Once we've kneaded it all the way, we take off a small portion and we apply it to the intaglio surface of the complete denture. And then we create a base and we seat the denture in place. Now at this point, we're going to go ahead and let this material set until it's very firm to the touch. After a few minutes, the putty material is firmly set up. I can go ahead and just kind of lightly separate it from my little plate that I have here. And the idea is I want to leave this denture in place. At this point, I can go ahead and measure out an additional 6 scoops of putty, or if I'm using the base catalyst putty, it's 3 and 3. So now I have my existing complete denture and my 6 scoops of putty, or 3 catalyst and 3 base. I can go ahead and take a little bit more of this separating agent and coat my denture. Now also, what we need to do is create a couple of little notches. And these notches, I just use a laboratory knife just to create a notch, more or less to give yourself a tripod when you connect all of these together. I'll put a 4th one in just for good measure, just like so. Now at this point, you do want to coat petroleum jelly all over the putty as well, because if you're not careful and you don't put separator on this, the putty will bond to itself, just like so. Now we're ready to go ahead and take our additional putty and start combining them. After thoroughly mixing, I take a small piece off in my fingers and I gently place onto the occlusal surfaces and on the facial aspect of my denture. Also placing some in the notches and taking the remainder amount of the putty, mixing it up like a hamburger patty, and then placing over the top of my mixture, just like so, and then pushing pretty firm so that way the top part of this putty is fully down over the edges, just like so. Sometimes what I do is I bunch it up to the side and then flip it upside down and push in that position, giving me that appearance. And I let this set for a few moments. After it's been a few minutes, we can go ahead and verify that the putty has been completely set. Now we're going to go ahead and do a separation, just gently teasing from each corner until fully separated, just like so. As we see here, what we're doing is inspecting the intaglio surface, or the underside of this putty impression material, verifying that we've got completely adapted all the way around the occlusal surfaces as well as in the facial. Same thing in here. We can separate the denture from that portion of the putty, verifying that we have a very nice looking tissue ridge conformation. The general idea of the putty technique is now I can take a clear orthodontic resin, fill it in here, and then combine the two of them together and put that into a pressure pot device. When that has been completed, this is ready to get sent to the laboratory. You can take your patient's existing complete denture, clean it off of the petroleum jelly, and return it to them. Now, once the putty duplication portion of this procedure has been completed, you can return your patient's denture back to them. This procedure can be completed now independently of the patient, and you can dismiss them. What we do is we utilize this putty duplicate and we pour in a clear orthodontic resin into this space and into this space, sealing it together and cooking it just like so. This can be done by yourself, a clinician, or it can be done by your dental assistant, or alternatively you can send this to the laboratory technician where he or she can do this in a laboratory controlled environment. I prefer to do this technique and this procedure by myself within my own office just because it's pretty simple and pretty effective time-wise for me to do. The first step is we need to select our orthodontic resin. I prefer this particular type. It's just an Orthojet liquid and powder. However, any sort of commercially available clear orthodontic resin is more than adequate. You will also need a couple of these disposable Dappen dishes, as well as a monoject style syringe for injection, as well as some sort of mixing device. And also, just for good measure, I like to recommend using some of these little brushes to help me put in the clear orthodontic resin. Step one is we can go ahead and put those materials to the side. What we need to do is we need to go ahead and place a couple of holes on the intaglio portion of this complete denture, so that way we can create one large hole and one medium-sized hole into this space. What I like to do is to take a laboratory handpiece with a round burr, and I'm going to start by preparing one single hole in this area just like so. And you punching through all the way until you come out on the other side. And then the same thing here until you come out on the other side. Now, what I like to do is take a slightly larger burr and just enlarge that hole. And approximately like that. And then take my burr and just round those corners, just like so. Same thing over here. Except that this second hole I'm not going to enlarge very large. And this hole I do like to enlarge a little bit more. Clearing this off. And clearing this off. Now we can see we have one larger hole and one a little bit smaller hole punching through the top portion of our putty duplicate. What we're going to be doing here is once I pour a little bit of resin into here and a little bit of resin into here, I seal it, tie it with a rubber band, and then inject the resin on one side, watching it come out the other side. Also, I've created a little bit of a reservoir channel right in here. This is just a little bit wider in here. I like to fill that up so that way it resists some of that pulling motion that acrylic resin does. Now we're at the laboratory portion of the fabrication of the surgical guide. The patient has been dismissed and their denture has been returned to them. What we're going to do is we're going to be utilizing what I mentioned before, the clear orthodontic resin, monomer, some mixing devices, as well as an injection type of monoject syringe. Our putty duplicate is right in front of us. We're going to go ahead and separate our materials just a little bit and prepare what we need to do. Now I have an extremely large denture because this is the one that we used in our course, so I have to use a little bit extra of the clear resin powder. However, in most clinical situations, 25 to 30 milliliters of the powder is more than sufficient. First step is I take my monoject syringe and I just trim off about 7 millimeters off the tip of the monoject syringe, so that way it injects a little bit easier. I'm going to take my powder and dump it into this large Dappen dish. This large Dappen dish not everybody has in their office. I do, just because I do a lot of laboratory work. Alternatively, you can always mix directly within this plastic Dappen dish, or if you take 2 cups, put them together and mix inside of here, it gives you just enough working time so that way you can pour this into our putty mold. Now do be careful because the monomer will eat at the plastic, so if you have like a Dixie cup or paper cup, that's ideal. Step one is we're going to go ahead and take a little bit of monomer just into one of our dapping dishes just to give us some liquid to work with. I'm going to set aside my putty just for a moment while I go ahead and start mixing. Now it's going to look like I'm over mixing this material as well as putting in too much monomer. This material, you want it to be nice and runny. And applying our liquid monomer just arbitrarily until it's almost like a soup-like consistency. Now at this point, what I'm going to do is take a little bit of monomer and paint it on the edge, and I'm going to pour some of this directly into my mold, just like so, and then also into this mold, just like so. Now, just as a safety feature, I'm going to take out my monoject syringe. That little piece of black out of there, good. And I'm going to pour this into my monoject syringe. And what this is going to allow me to do is create almost like an injection-like device. I put this top on here, being careful and mindful of this shooting. There we go. You have an air bubble pop up on you. What I like to do is just take my putty molds, combine them together, just like so. Put my rubber band on, and then just start injecting. I inject through the larger of the holes, verifying all of the material is in place, and many times I'll see the material start to come out the other hole as well, as it is right here, and sometimes it'll come out the sides. That's not a big deal. And we're at this point. I'm going to fill that monomer like that, and I like to put on a second rubber band just for good measure. There we go. Perfect. And now this is ready to go into my pressure pot. As I take this over to the pressure pot, I hit the button, open it up, and take my putty. Goes into warm water, not boiling. Close it, and then apply pressure until it hits 20 psi, which on this pressure pot is the green marker right there. We give this approximately 15 minutes, come back and we'll remove it. After approximately 15 minutes, we can release the air pressure vent hole and remove the lid. Depressurizing the flask and removing our putty material. Now at this point, when we remove our putty from the pressurized flask, we can remove the rubber bands and very carefully separate the putty, giving us a pretty good idea of our duplicate. Now the maxilla won't usually, or excuse me, the top portion won't usually come off easily just because you have those little vent holes. However, you can pop these parts a piece, everything apart, and what you sometimes have to do is take an instrument and burr off the top portion here. So now at this point, I've went ahead and I've removed the top portion of where the injection sprues are, and I can very easily remove my duplicate denture. As you see here, this is a clear version of my patient's existing complete denture prior to cleaning up. But the key is I want to be able to see these little sprue channels, and that allows this to get a very nice cure. If I don't use these injection channels, a lot of times this material will either be overfilled or you could have some suck back and there's going to be voids inside of here. At this point, I can put my putty aside while I go ahead and I take some burrs just to start to smooth this off. Now, as you start the finishing and polishing procedures, you might occasionally notice you might have a little void on the inside part of the surgical guide. Pretty simple to fix. Just take that, punch a hole through the side of the void, and I'm going to fill that in with a little bit more clear resin. So to fill in some of these little tiny voids that you might occasionally get during the injection molding process, it's pretty simple to do. Just grab a little bit more powder, mix in some fresh monomer, and your cleaned up Monoject syringe. I typically take that same Monoject syringe, just put a little bit of air pressure behind it, and it cleans up pretty easily. Make sure it's nice and runny. And similar technique, I just pour it in. Fill my Monoject syringe, being careful to watch eyes as well as walls. Okay, and I'm just going to fill in a couple of these little voids just like so. It doesn't need to be perfect. This is just to fill in a couple of these structural voids, so that way you can have a very nice looking surgical guide. While not critical, this is more or less for those perfectionists out there. And back into the pressure pot. At the completion of 15 minutes, we're going to go ahead and release the air valve. And opening the top lid to verify that that resin has been successfully added. Where we're going to go ahead and then finish up some of our polishing using my lathe burr and my rag wheel. So at the completion of our rag wheel polishing, we can see that our clear orthodontic resin denture duplicate is looking pretty nice. And if we hold that up as a comparison point to our existing complete denture, it replicates very closely where the patient's denture and the surgical guide should be exact copies. Trying it back onto our patient, we can see that it has an equal fit as what we had with the complete denture. Now, if this were a soft tissue supported surgical guide, I would recommend using some sort of disclosing media like a pressure indicating paste on the intaglio surface of the complete denture to ensure that it's fitting down all the way. Even though it's a very nice way to copy a complete denture, you do have a significant amount of resin shrinkage that, if you're relying upon this denture to be an exact fit in terms of the soft tissue, you do have to be careful. Now, to get to this point where we punch in our 4 holes into our complete denture, we need this little simple device and our putty. What we're going to do is just take out a surveying table and put our putty onto the end of it. Doesn't have to be exact, as long as it holds nice and firmly, as we see here. Now what's nice about this is we can take this to a drill press. Now I don't have a drill press that I can very easily record. It's back at home in my garage. But in a current office, what you can do is you can do this pretty well just using freehand methods, or if you do have a drill press in your practice for making surgical guides, that's fantastic. However, most people don't really have one. You can go in and you can buy one down at Home Depot or at Lowe's for about $100 to $150 maximum, and I do recommend doing that because you get nice parallels in between the implants. Now what we're going to do to get to this point where we know exactly where we put our holes, I'd like for you to reference the August 2014 Dentistry Today, and I'm going to zoom out here. And this right here, this is me at the top left corner, and we talk about implant treatment planning in this edition of the Dentistry Today magazine. If we open up to my section where I talk about overdenture implants, this is a very nice way of going ahead and getting some background information on the overdenture implant treatment planning, talking about surgical guides. But what's most important is that these 3 steps of where I get to know exactly where my holes are going to line up. So as you see here on my patient's cone beam scan, I can see the frontal profile as well as the occlusal direction of where my 1, 2, 3, 4 green dots are, and then also my approximate angulation, and then also from a side direction. And what we do is we take it to a drill press, just like so, on this little putty table with the surveying table, and using my Zest 1.6 millimeter drill, punching a hole at those 4 locations. What we like to do is go ahead and take these 4 marks, and what I'm going to simulate is just grabbing just a Sharpie type instrument, and let me zoom in. And what I'd like to say is to simulate my 4 LODI implants approximately there. What you'll do with the drill press with your LODI drill is take the drill press until you match up this position as well as when the denture's out of the mouth on the ridge. So when it's on the drill press, my drill press is looking just like this, up and down, or from a side profile, up and down. And I'm going to make sure that it fits without the denture as well as when the denture is present. That's going to give me this type of orientation where you can see 1, 2, 3, 4 holes in comparison to where we were before. And right in here. But nonetheless, what you can always do is you can always cut a trough on the lingual portion of this surgical guide, like what you see on the picture in front of you, and that can always give you the assessment of where the relative tooth positions are. This is very, very critical for proper LODI placement because knowing where your prosthetic position is going to make your surgical procedure that much easier.
So what you're looking at in front of you is the final surgical guide for you to modify at your own leisure. Thank you for tuning in. This is Dr. Michael Shear with Learn LODI, a free resource on how to market, treatment plan, place, and maintain LOCATOR Overdenture implants.